Now I'm feeling very good and comfortable. The last 2 months journey of the treatment we had here, and I'm extremely pleased and feeling very well. But the major points that I would like to highlight during this treatment from since starting was that the way you have advised me, you guided me, you explained me what is this disease, how it is caused, and what is the treatment, and how much time this will take to be completely cured. And this really helped me to make up my mind to understand the progress or the process of the treatment. And the most important thing that we should realize, this disease is not a non-curable disease. It's very much curable. The only thing is that the doctor you are consulting has very much interest to deal such kind of disease. People should take this disease as positive as they normally take other disease. This is not a life-threatening disease, and maybe sometime because the place of this disease could be the reason of your discomfort. But the one thing I would like to mention here, the kind of treatment I got here was never frustrating for me. I never felt for a single day that there is any change in my normal routine or my life. I lived my life as usual as I am living today or previously from detecting this disease. So this was the most important thing, and it all due to the kind of treatment technology and the kind of methodology used by Dr. Ashish Bhanot. Otherwise, you can be an easy victim of other treatments like or some traditional surgeries. They could cure you or may not be, but most of the time, 9 out of 10 times, you would be the victim of that kind of treatment. So my personal suggestion is that please consult with correct doctor and understand the type of the procedure you will have and the length of the procedure would be. No doctor can heal you. Doctor can only treat you. Healing is the process of our body. Treatment is in doctor's hand, but healing is not in doctor's hand. Healing is all depends on your mental state, on your body state, how you are taking your disease and how your body is responding. And body only responds when your mind is positive, your thinking is positive. If you are taking your disease as a negative, if you are thinking why I am suffering from this disease, why it happens with me, you are not the only one in this world. Lot of people are suffering from this disease, but only those patients are coming out as a winner who took their disease as a positive illness. So most of the time people thinks why fistula is taking a lot of time, because the time of treatment depends on the length of the track of you have. Some people have 1 or 2 centimeter track, they may be healed in 1 or 2 weeks or 3 weeks. Some people have 4 to 5. If someone has 10 to 12 centimeter, definitely it may take from 2 to 3 months. Also, you have a low kind of fistula or high kind of fistula, means you have a below the rectum or near the rectum. So all these different factors that depends and includes in the time of the treatment. Fistula is a common word for this disease, but fistula are of various types. They are not the same type. There are various kind of fistula. It depends what kind of fistula you have in your body, and treatment time will be depend on that. Single track, there will be multiple tracks, right? Then what I said, there could be, and the placement of the abscess or the pus in your body, it also plays a major role. Someone has in the lower part, someone may be in the upper part of the anorectal area. So all these factor in combines, when comes together, it all depends on your treatment time and the type of the treatment you will have. But yes, Dr. Ashish Bhanot is one of the best doctor who can treat any type of anorectal disease. This is my personal experience. I don't want that anyone should be or could face this kind of illness. But yes, if you are facing this problem, do not hide it. Please do not shy. Contact Dr. Ashish Bhanot immediately. Since my first visit to doctor's clinic, Dr. Bhanot's clinic, doctor has clearly explained me what kind of fistula I have, and it will take 2 months. And my major worry was that because this kind of disease is near at the anal area, so would I be able to continue my normal life? Would I be able to join my office, or I need to take off from my offices? But doctor said no, there may be hardly 1 or 2 day or maximum 3 day leave you need just to get out from your discomfort after the first surgery, but after that you can continue your normal life. So again, I want to add here, I never missed what I said earlier also, I never missed a single day off from my office. I never felt frustrated or a patient during that period, right? Even nobody in my office or in my relative comes to know that I am suffering from such disease, because my life was absolutely as normal as it was before my treatment started, right? But again, it also depends how you are taking your disease. So I did not find a single day off from my office, or I didn't like or find a reason to get off from my office. I searched a lot about this disease on the internet. I read a lot of articles from Indian doctors, international doctors. I searched a lot of websites on American hospitals, Canadian hospitals, Australian hospitals. Even I searched a lot of documents and articles from the researchers on this disease. What scientist actually says about this disease. And the most common thing what I understood from all these study, this illness cannot be cured by the antibiotics. Why this disease cannot be cured by the antibiotics? Antibiotic may kill your bacteria, but the tract already formed inside your body cannot be healed by the antibiotics. So to heal that tract, the only treatment is the surgical. But there are a lot of surgical treatments are available in the market, like fistulotomy, that is the traditional treatment of fistula, but that is quite painful treatment, right? Earlier we do not have such kind of advanced medical technologies available in our country, so the patient had only one way to go treat it, that is the fistulotomy, in which they need to cut the whole tract, and that took around 5 to 6 months or more time to be healed properly. And then some other treatments from Ayurvedic, that is called Shar Sutra, but that is not hygienic and that is not 100% secure. But the major thing is that it's very painful, done under very unhygienic conditions. The latest available medical technologies, that is VAAFT, video assisted anal fistula treatment. This is very latest, very easy, and it's a daycare surgery. You can go home on the same day you were treated by this technology. This is the main advantage of this technology. Disease can be exaggerated if you are using some wrong treatment methods, right? I have seen during my treatment a lot of patients came here who has suffered and treated by some other methods, but their illness got exaggerated after that. I feel very lucky about myself, because I have started my first treatment here with Dr. Ashish during the VAAFT technology, right? But all the patients I met here, most of the patients are already suffering from the bad stage of this disease, right? They have already taken some earlier treatment from some other doctors like Shah. Most of the patients have told me that Sutra is a very painful treatment. It is not a very hygienic treatment, and there are always the chances of infection in this treatment, right? Second, the patients I met here, the condition of these patients were very critical. They have almost spoiled the condition of their disease, right? But after the first VAAFT surgery here with Dr. Ashish Bhanot, when I met all these patients, they all were feeling relaxed, comfortable, and the kind of confidence they showed me after their first surgery. So the kind of frustration I saw in these patients before the surgery and the kind of confidence I saw after the surgery, there was a huge transformation in these patients.